This is an interesting one. So DJ Moore got taken to the hospital yesterday after the game, and there wasn't too much information about it, but he had a groin injury apparently, and they monitored him overnight for it. So, what do you think about when that happens? I think about a significant muscle belly tear or possible fracture that they had to monitor for surgical repair, but then they called him day to day. So, that kind of rules out any kind of significant musculoskeletal injury, fractures, that kind of sort. So then I started thinking about the testicle. For one thing that pops into mind when someone talks about a groin injury that required an overnight hospital stay for observation is something called testicular torsion. And that's where the testicle, brace yourselves. If you guys don't want to hear about this, you should probably turn it off if you get kind of cringy or stuff like that. But testicular torsion is actually a pretty big emergency. It's where the testicle gets twisted around and it causes a lack of blood flow to the testicle. And that's considered a surgical emergency because the testicle can die, become necrotic, and cause a lot of severe health complications. So it has to be identified emergently through imaging, and they can do a couple of treatment styles for it. It's a surgery if it's completely torsed and they're unable to kind of disrotate it. The biggest thing about it is that it's typically caused by a genetic factor where the testicle isn't stabilized to the scrotal sac, but in certain situations it can be caused by trauma. So I think what happened possibly if it wasn't some sort of musculoskeletal injury or if they weren't concerned about some significant infection for some reason is that he had a partial torsion. They were able to manually detors it, not require surgery for it. And they're basically seeing how stable it is and if he's able to press and play throughout the week. But overall, just kind of an interesting differential when we hear about these kind of things in med school or residency. You hear about a couple complaints, a couple concerns, symptoms, and you're supposed to come up with the differential, the diagnosis, and this is kind of what we're doing today.